two handouts for you. One is this page here. And I was looking at this backdrop here with all the colors, and I asked somebody at my job, which is at Silver Key in Colorado Springs, we primarily serve seniors. I said, should I number this or put colors? He goes, put colors. I said, I'm colorblind. And he said, it's about your audience. So you have colors on your paper, and I will do my best to help you walk through this little bit of a presentation for you. Originally, when I had contacted Summer many moons ago, one of the things I was extremely frustrated with is that and you're all aware of this at this point, I'm confident, is that the RAE had reduced the rate for the provider network to 20% effective January 1st. You're aware of that. Since then, Silver Key has been around Colorado Springs serving seniors for about 50 years now. This is the first time that any board member can remember that the entire board had taken a stance, unanimous stance, that we were going to take some sort of action to be able to bring this forward as an issue. And the board completely voted unanimous to do so. In doing so, one of the things that's happened is that we've been well connected with a number of legislators, senators who are potentially evaluating sponsoring this bill for some legislative action. So I'm not going to spend a whole lot of time on this. I know you've heard the impacts of the stories with the provider network, should they not continue in those type of issues. However, the good news is for Silver Key is that we have become a provider for behavioral health services for seniors, credentialed to Medicaid to provide services. One of the things that's become visible to me that's been invisible for a long time is the second thing on this agenda here, which I say seniors ages 65 or better are, of course, Medicare eligible. But one of the things you may not know is that many individuals over 65 qualify for both Medicaid and Medicare. And just real quickly in definitions here, QMB is a supplement program that comes forward for Medicaid to be able to offset some of the premiums for Medicaid. SLMB is for low-income Medicare, and that covers the benefits for Part B premium of Medicare. The reason I'm giving you these definitions is because there's a major gap that's emerged that I'm aware of now. This third one, QI1, this is for qualified individuals that benefit from the full state benefit package, and this includes the behavioral health programs. So when somebody is identified as having both Medicaid and Medicare eligibility, the challenge with that is that is true on Medicare. There are services available through Medicare. But the problem is that if you're 65 and low income, Medicare does not cover case management. So therefore, you've got individuals who are now under-resourced in their care from a behavioral health perspective. Also, the provider network that's available to serve Medicare are LCSWs and psychologists and PsyDs. What that means is that there's a whole lot of volume of population that needs support, and the provider group that is credentialed to provide that service to Medicare are not able to. Medicaid allows for that service. So just very briefly here, on Medicaid, QI1 is we serve people, Silver Key serves people ages 60 and above. So we have individuals that we know qualify in that category of 60 to 65 for both Medicaid and the full state benefit for alongside Medicare. And that client must reapply at 65 for any of the Medicaid benefits. And as you go down this yellow right here, you'll see that the client is qualified for QMB or SLMB, but may not have qualified or been qualified for QI1. And this is part of the major challenge that has become very visible now to me and my organization. And so just real quickly, waivers exist related to PACE, autism, DD. Now that does not include the state-covered state plan. That makes sense to me because those are all inclusive types of model care for behavioral health. The two boxes in the middle, both the blue and the white, are the supplemental plans that people can qualify for. The green on the far right is where the real issue lies, is that if we don't have an evaluation of individuals moving forward to be able to be qualified under that full state plan benefit, then what happens is they miss the opportunity for us to be able to provide comprehensive case management and therapeutic services, because again, we know that there's a gap in the amount of workforce available to meet those needs for seniors that need care, but the only credential that's available are psychologists and social workers, and there's just not enough providers. So just very quickly, The theory, seniors are not automatically being evaluated for QI1 if Medicare and supplement programs are approved. I think the perception is, and this is where it goes from invisible to visible, I believe the perception is this senior now has a full range of behavioral health support under the Medicare benefit, particularly because they're qualifying for the supplemental plan. That is a misnomer. And so I did call every single department from the Ray to the HICPUF to every single alphabet soup that you can think of. And one of the things was probably the most disheartening statement that I want to make sure that I say loudly and clearly here is when I called HICPUF, one of the people who processes this work, she had said, every one of them say, you're absolutely right. Individuals that are low income, that are seniors, can qualify for the full state plan, QI1 and Medicare. And I said, then why isn't it happening? This is what her response was. She said, here's the issue. Nobody's bringing it forward. An individual case by case is the way we handle this at this point. If a senior brings it forward, we will address it and get it worked through. And I said, why isn't anybody bringing this forward? It's because the whole system, I believe, has been conditioned to believe that if you get Medicare, you have the full range of behavioral health benefits for those that are lowest income, highest need, most marginalized, and we stepped away from that and let it be. Consistent with what we know about seniors, they're often the most disenfranchised, underserved, and under-recognized population, period. This is wrong for many reasons. If Medicare and the supplement program are approved, this reduces access to care as there are not enough providers in the Medicare to meet those needs. Because again, just the LCSW, PsyD, and PhD. Prevention, early intervention is more cost effective. If we have a number of seniors that go to a hospital level of care and they're billing off the Medicare benefit, that's fine off of the Medicare benefit. The reality is taxpayers will pay for this if we could have done case management and comprehensive proactive prevention support on the front end. The provider network doesn't exist out there to be able to champion this cause. Now that Silver Key is a provider, I guarantee you that Silver Key is championing this cause. We have 7,000 people in our population that we serve, of which we know 70% qualify for QI1 benefit, and yet we can't find 10% in our population that has, because all 70% didn't know how to articulate their issue and be able to get it to move through the system.
Jason, you have about 30 seconds.
Okay, arbitrary and inconsistent application.
Here, Jason, before you go on,
Yes,
are you suggesting then that it's a county educational, when they enroll them back in Medicaid, that they're looking for this additional benefit to be alongside Medicare? Is that what you're suggesting?
I think what it is that it's a county system, but it's really more probably in the algorithms that have been set up in the way that people get processed for benefits.
Right, but we're trying to change that right now, so if you believe that's where it is, it might be it's the JII work.
That's it, I think it's the same thing.
Yeah, that may be the case, because what's happened is that I think what happens, they get approved for those 2 full benefits, and then it doesn't get even popped to be able to be reviewed at that third, so I think you're right. That could be one of the options to solve this issue. I did see that there was some effort happening to improve the eligibility process. This is a population that's falling.
Right, it's trying to match right people with right program and make it easier for the county workers to know
Exactly.
what people are eligible. It sounds like that's an opportunity that's sort of a hidden awareness issue with our 4,600 county workers.
Exactly.
Right, okay.
Arbitrary and inconsistent application of protocols opens all of us to heightened scrutiny and potential legal challenges. Some seniors need the support of comprehensive case management and behavioral health support, and that's only available through the QI1 benefit, or in Silver Key's case, we continue to try to raise community funds to do so, and we know that donations are becoming more lean, and so we have to figure out another solution. And I do think it's a shame that we have this opportunity, and I would echo what you're saying, is that I think that there's a solution there, but it's not on the individual caseworkers that are evaluating this, it's in the system somehow. The caseworkers believe that they're being fully evaluated for all the benefits, and that is not the case. And I can give you examples why. I know it was only 5 minutes, but just so you know, this represents many agencies, so I'm kind of taking poetic license at the end. So.